are live now.
Pranaya?
Yes, sir, you can start. Yes, sir.
Yeah. Good evening, everyone. And this is a very special webinar that we have organized today in association of IAP Raigad and IAP Palghar. So there are many people, doctors from other pathies also have joined to this webinar. And so IAP is Indian Academy of Pediatrics, our Raigad branch and Palghar branch. So the idea of having this webinar is because we know being a pediatrician is like to be in an action movie. Like only the villain is the fever, tantrums, and all that. The problem, what we face in our routine practice is that we are examining our, on one side, we are examining our one child, and on other side, we are reassuring the patients. Then we are checking our vaccine stocks. We are giving instruction to the nurses. Then, so there are multi-pronged approach of a pediatrician, and it leads to the burnout. So pediatric is one of the top 6 specialties which have a burned out potential, because we are facing so many situations at a time that it becomes overwhelming to a individual. So what happens, even if you are academically brilliant, even if you have a good administrative capacities, there are chances that you can make mistakes. So now imagine a super smart junior, a virtual person who can remember every guideline with a recent updates, who can instantly give you differential diagnosis, who can give a prescription in a good handwriting unlike yours, and give the every patient proper feedback on time. Is it possible? It is possible with artificial intelligence. Mind you, the many people are scared that AI can replace doctors. But to my, when I feel that every parent will like to have a human doctor to touch his child, not a robot. So AI cannot replace a doctor with heart. So today we are going to have this webinar with help of respected Dr. S.V. Kulkarni sir, whom I want to introduce. Sir has a vast experience of 43 years, almost equal to my age. So he is a professor of medicine and head of the department at MGM Health University and Medical College at Panvel. He has finished his MD from Miraj at 1982. And he's a trainer, mentor, pioneer, and proponent in the digital medical technology, that is IT and AI. He is also hailed as a father of clinical digital technology and AI in India. So we're having such a person to guide us regarding the use of artificial intelligence in routine clinical practice. I know that there are many doctors from other pathies also have joined, and I will encourage everyone to put their questions in the chat box, because there is going to be a lot of discussion, and there are people from all over the world have joined to this webinar, and our cumulative intelligence will definitely sharpen our practice, our clinical understanding, and our cognitive behavior to handle our patients. So I request now Kulkarni sir to take her from this point.
Okay, thank you. Thank you, Vikas. Can you stop sharing?
Yes,
Friends,
stop, sir. Yes.
welcome and good evening for something really very exciting for all of us. And we are going to discuss the practical use of AI in clinical medicine and pediatrics. I must thank IAP Palghar, IAP Raigad, that they have decided to have this particular topic, and my friend from US, Dr. John, who has got a neurosurgical TV channel, and it is being live telecasted with that. What we are going to do for next 40 minutes is in what smart way a primary care physician can use AI tools. We are all working in small town primary care as either pediatricians or physicians. AI is definitely a boon. It improves administration, patient care, avoids complications. Now, for example, drug interactions. It aids your research publications, at the same time personal well-being, and friends, it avoids burnout, use more family and more recreational time. John, in your language, it is the pajama time which is reduced, and you can take care of more of your personal things and improve your practice. So this is partnered with academically with Doctors AI and Indian College of Artificial Intelligence, of which I represent as Dean. Thank you, Vikas, for your kind words of introduction. Friends, a question is asked always, why AI? AI is there everywhere around us. But why AI in medical professionals? You just look around, take any profession, banking, travel, your newspapers, magazines, everybody is using AI so nicely, except for medical professionals. So this is my sincere attempt to sensitize you. There is a huge presence of AI, almost to thing like a height. There are a lot of early successes like ChatGPT. There are huge untapped potentials, absolutely huge untapped potentials of there. But there are a few lingering questions that whether AI adaptation in healthcare and the benefits of early adaptation are going to create dumb doctors. So friends, we are exactly at the crossroads. We have survived COVID. In India, at least, John, we can practice, download and adopt any technology tool from anywhere. But discussing this unique term, it represents generations which have been taught by teachers, mentors, colleagues. We can recall the all or old libraries of medical colleges. Now we are in the age of enhanced computer-centric chatbots or GPT-based training, which is all around us. Friends, it is a story of 51 years. I started my career in 1974, and this was the time all of us, all 113 people used to look like that. And in the last 3 years, something absolutely phenomenal has happened. 2023 was the year of discovery of generative AI. 30th November 2023, first time Sam Altman declared ChatGPT. 2024 was the year of application and adaptation, people getting sensitized. And now enter 2025 for fights and dominance of LLM, that is large language models. We don't know what is ahead in the next 10 months or next 1 year, but let us hope for best of everything. Here you can see how the spectrum of generative AI has gone up and how the new things are coming up. I agree that my topic is diffuse. It is a bit defocused, but surely it will anchor something definite, standard, standalone, and critical action which will improve your practice. Few of my physician friends have joined from all over the state. They also used to tell me the same thing. We just talk about it. It is universal, ubiquitous in clinics, hospital, courses, conferences. But we must know the right way of using. And please, with a purpose, every slide of mine is not complete. You can see here various names which we are using. You open your WhatsApp, Meta is following you. If you open your Google, you have got something which is ChatGPT, OpenAI following. So these all agents are there in our mobile phone. While talking about this, I have certain disclaimers. I'm not an expert or coder. I don't have any degree, but I procure, practice, and preach about digital technology and AI. Like all great medical innovations were ridiculed, looked down as crazy, I am not an exception. But I did not go disappointed around 15 years back and still pursued the part of AI, and now this is the situation. I got a lot of friends of mine. My organization, Doctors AI, is one of the fastest growing network of medical professionals connected towards a common goal of effective and ethical use of AI in healthcare through education, research, and validation. And these are my colleagues who are really very expert. Practically everybody of them are now in a different webinar at this time. There are no conflicts of interest, no grants from manufacturers, software developers. I have purchased all on my own, and this is I critiqued, evaluated, and then I put into the slides. I have not used AI in creating slides except for a few. It is all your cheering up, encouragement, support for following unconventional. So that is the passion for AI. Some of the slides which you will see with Doctors AI, they are created by using AI tools. Friends, I bring greetings from this beautiful place called as Navi Mumbai. And the next airport is going to be here in Kharghar, just behind our home. And this is the 6-point outline of presentation. We had some introductory remarks, some quiz, some trivia. We'll talk about what is the status and scope, how we can use it in practice, what are the different prototypes, how we go way ahead, how we do it on your own, and what is the future will involve a lot of many question, answers, and demonstrations. We're just discussing with Vikas that AI has to be learned. It cannot be taught. Those few steps will help you for learning. Is AI in medicine that much unexpected as coming as tsunami? Yes. Just try to understand how everyone picks up technology. Evolved under our parents, teachers, colleagues, or under AI. We start with finger count, abacus, calculators, computers, and then all the new things have come up. But they have not come very easily. These are our childhood friends. But I request you to concentrate on this. You look at Netflix, it required almost 1300 days to get 1 million users. ChatGPT got within 5 days. That is the power of the generative AI. Is it a very new science? No. It is a very long story with great expectations. In 1956, Dr. John McCarthy, he coined the first time the term artificial intelligence. It uses computers and machine processes to simulate human intelligence. Mark the word simulate. But it performs complex, automatic, repetitive tasks, and it seeks to reflect the abilities of the human mind. Reflect the abilities of human mind. AI-enabled machines are also capable of exceeding it in a number of ways, particularly by sifting through large volume of big data very efficiently in order to identify patterns, anomalies, and trends. It is not artificial, it is augmented, assistive, affirmative, add-on, or accelerated data science for all of us. So while we are introducing you this new technology, try to understand AI is the ability to make computers to do the things that would require intelligence if done by humans. Intelligence we usually define as a group of abilities such as understanding, learning, and reasoning to make decisions and to solve problems. AI emulates these aspects of human intelligence by means of number of tools. So we are going to come this word tools and agents. So these are the different kind of tools which help us in getting the tools. I am going to go quickly for a 5-question quiz, a trivia or a base for tsunami of AI. You can identify a computer by name, the name and the nature of a shade of a color. It defeated X times world champion. who spoke Russian and walked across in a checkered game, paved way to something innate which all of you have. So everybody must have guessed it absolutely right. The name of the computer was Deep Blue, and it was Gary Kasparov in 1997, who was the 2 times world competition and defeated by Deep Blue. So this is the evolution of AI all over the time, right from 1950s, Alan Turing, then 1957, John McCarthy. There was a first AI winter, almost 13, 15 years, nothing happened. Then came the second AI winter, and post-COVID, it just boomed up like anything. Try to identify this gentleman, a physician, advocated technology in India long time back, and his name is Dr. R.D. Lele. He's 25 to 30 years back, he had written these 2 books in computers on in medicine. Whatever mobiles and laptops which we have got in front of us, they are the courtesy of this person from Thane. His name is Dr. Prabhakar Devdar, who was the first commissioner, Electronic Corporation of India commissioner. He brought all this technology in India. So these are the different types of aspects of use of AI in healthcare. Let us say that AI is not only the present, it is the future of healthcare. It is rapidly evolving in the whole medical landscape. The transformative force. It offers personalized patient care, advanced diagnostic to optimize treatment plans and streamlining hospital operations. AI promises a revolution in healthcare delivery. Let us consider the 8 main parts: personalized treatment, virtual health assistance, advanced diagnostics and imaging, predictive analysis, remote AI monitoring. We had done this during COVID time. We are optimizing surgeries with the help of robotics. We are getting treatment optimization by reducing the number of drug interactions. And of course, drug delivery has been accelerated with the help of AI. Let us not forget a contribution of these 4 persons. Martin Cooper, who in 1973 had first mobile phone. Samuel Hurst, who devised a touch screen. John McCarthy, you can see him here. And Leland C. Clark, the person who is called as the father of biosensors. The first biosensor who we invented was of glucose. And then after, there is a huge explosion of biosensors in digital technology. Last question is something very simple, but it tells you different 8 sites. You have to tell which is not a medical website. Diagnogenesis Pro, it is for diagnosis. Medicine is for radiology. Index helps in research. AI Doc Assistant is for papers. IDX is for treatment. Merative is the same as Watson. PathI is for pathology. The only odd person out is Namaste AI, because that is the website of Air India magazine and Air India, our national guest. So friends, from the 5 quiz questions, let us come down to the reality. I am going to talk about understanding basics of definition and types, common terminologies, not going to make you confused about it. Why and where does a clinician start with AI applications in AI, from clinics to research? And last question, will AI replace physicians? So this is a standard phase of perception of any technology. Any new thing which come, there may be rocket science practice to adopt. These are called as the innovators. Then there are early adopters, there are early majority, there are late majority, and there are laggards. These are the people who don't get benefited. But majority of us, we fall in this particular sector. But whenever a new technology comes, as the technological trigger goes on and with the visibility, there is a peak of inflated expectations. There is a trough of disillusionment. There is a slope at alignment and plateau of productivity. And if you look at this graph, on the top of it, it's still generative AI or ChatGPT. This is called as a hype cycle of artificial intelligence or any technology. And you can visit the website called as a Gartner.com. You get a really interesting information. So why to adopt AI in medicine? Very simple. It is accurate. It handles big volume of data. It is consistent. It saves time, money, and efforts, the trouble and torture of travel. Example of telemedicine. But friends, it increases our serum levels of confidence, concentration, competence, and enthusiasm. It makes you acceptable, adaptable, humble, a new learner from everybody, including your juniors. There are many other tasks which can be used, like transcribing a patient note, business meeting, creating routine patient communication. Imagine a patient coming to you, you talking to him, and a AI agent picks up all the conversation and gives a printed note to you. Review and analyzing relevant medical literature and data, evaluating a research paper, writing, evaluating business practices, your performance. There are many things which an average practitioner doesn't know in hospital management. You can predict patient census, flow, and trend, creating staff schedule, predicting workforce needs, and getting evaluations and anonymous peer review feedbacks. And mind it well, AI doesn't take holidays for Raksha Bandhan or Ganesh Chaturthi. It doesn't suffer from common cold or doesn't send a sick note. They are the positive benefits: availability 24/7, accuracy of best. It enhances your efficiency and it can be personalized. There are many things. We have to ask one question to ourselves about future readiness. Are we really future ready? The other benefits like accessibility, anybody can download ChatGPT, put a X-ray or put a blood report and get the analysis. It's a chance for personalized learning. I can tailor educational content to meet the individual need of medical students by the pace. There are slow learners, there are fast learners, there are some super learners, but the super learners will not compete, will go well with the slow learners. It adapts to the learning patient's type. Simulation and virtual patients, a safe environment for students to practice clinical skills and decision making without the risk of real patients. Last week we were in Pondicherry and it was surprised to find out one full floor, which was a patientless hospital with all types of mannequins and all the simulations. Data analysis can be done in a very, very fast way and you can make papers very quickly. There are chatbots, which are intelligent training systems, virtual patients in simulations, gamification, quizzing and rewarding is a very good way of treating condition like type 1 diabetes. You can do adaptive learning assessment. Must have seen the example of optical mark recognition in the 12th examination. There is an automatic essay, article or thesis scoring system which are available. You can just put it and it will tell you also that how much of it has been a plagiarism, how much has been from the source. We are now in the world of virtual, augmented, mixed and immersive reality. Very useful for condition in branches like physiotherapy and all our diagnostic, analytic, interpretive, prescription writing skills during the emergency are going to be enhanced with the help of different kind of AI tools. So accuracy, robustness, and explainability are the three major things, but you should not forget the cost. Cost is definitely affordable right now. It is versatile and most important, multimodal. What do you mean by multimodal? You can put text, you can put voice, you can put image, you can put video, and it will analyze everything. According to the time of the organizers, I can demonstrate you certain things. Now, right now, AI is most often used for the administrative tasks, unfortunately. Creating patient scheduling, appointments, lab tests, chatbots to interact with patients, record keeping, analyzing X-ray, teleradiology, and AI in radiology is another very fast-going branch. Analyzing non-imaging patients' data and test results, assisting the patient's diagnosis when all the data comes here, and tailoring the patient's treatment plans and creating handouts for specific conditions. Suppose I want to do something for hypoglycemia or Dr. Vikas wants to do it for a nutrition, pediatric nutrition of a 11-month-old child who has who has got malnutrition. Where it is going to take us? Why we have to ask this question? It elevates our clinical performance. If you see this line as a standards of care, here we are below, but with AI, we will definitely go up and above the line of our quality of care. This was the evidence-based medicine which we are proposed to practice, and now it is going to be intelligence-based medicine. And precision medicine, with the help of population health, when it combined with knowledge, the information and knowledge gap will be reduced and the patient community will be benefited best. So we'll just talk about very simple two or three terms. People call something as general AI. There is something called as a general versus narrow AI. Narrow AI is also called as a weak AI, and it operates within a predefined context without consciousness or emotion. You can take any ASCBD calculator or any other calculators which are available on our smartphones. General AI has got a flexible intelligence capable of learning various tasks. It adapts and improvises solutions akin to human intelligence. That's why it is called as a generative AI. While narrow AI specializes in particular domain, general AI emulates broad human intelligence. So these are the stages of AI development, called as artificial narrow intelligence. One of the example is Siri, Alexa, or otherwise. This is called as a machine learning. Then comes a stage of machine intelligence, refers to a computer that is as smart as human across the board. And super intelligence, achieve this phrase, called as a machine consciousness in an intellect that is much smarter than the base human brains in practicality by every field. So let us decode these three phrases again: artificial intelligence, machine learning, and deep learning. They are all part of each other. And these are the different spectrums. These are the different platforms which are there in which we try to learn these technologies. So the generative AI part comes here, and these are the modified and very selective tools which will help us in getting our work done very fast. It is a big blanket. These are ruler-based logic like risk scores. These are predictive models, targeted neural arcs, but generative AI is progressing towards this side for a better. Now, I will request all of you in your free time later on, try to download these two tools. One is called as a Perplexity Pro, another is called as ChatGPT 5. For ChatGPT 5, you have to go to the website of OpenAI. And if you are a Airtel user, you will get this Perplexity Pro worth 17,000 a year free. But what are the advantages where you should use Perplexity and where you should use ChatGPT? No doubt they are advanced assistants, but Perplexity is good for doctors because it focuses on research and information retrieval. ChatGPT, on the other side, is customizable responses, more generalized. This offers coding. We don't need to do it, but ChatGPT 2 offers coding capabilities, but to the lesser extent. There is a less personalization in Perplexity, but there is a broader knowledge base with ChatGPT. It boosts productivity, but with this enhancement, what we get to ChatGPT in medical professionals, I request everybody of you to definitely try first with Perplexity, any question which you have got in your mind, and then compare with what answer you get from ChatGPT. All the things in AI work on prompt. So what do you mean by prompt? It reflects the best practices in the engineering technology and effective AI interaction. It is like a baby, how to walk, how to talk, you have to teach them. So first P stands for provide context, give the AI clear background and relevant details to help it to understand the task. R stands for role specification, define the role or perspective that AI should take to frame its response. O stands for objective focus. Be specific about the desired outcome, format or style. M stands for meaningful example, including sample inputs or outputs to guide the AI responses. P is the precise instruction. You give precise instruction using detailed and unambiguous language to avoid confusion. Because this is a machine. The machine gets confused if you use words which are conflicting. And the last stands for test and tweak. It is refines prompts based on AI responses to improve accuracy. Suppose if you give a wrong prompt, then it may happen that it itself will tell you that, do you mean something like this? Why AI we should be used by a small town pediatrician? Friends, we have got long hours, administrative load, less family time, limited untrained staff and resources, need for efficient, affordable solutions. Can AI tools help me? Yes. Even being able to, why we are unable to do research, publications, and impressive presentations. You have got full right. You can do publications, you can do fantastic presentations. Look at the percentage of the time. We hardly get a small bit of our work in research and publication, but AI is going to help. So the practice administration can be done very easily by appointment scheduling, reminders, automated billing, and inventory management. Chatbot for FAQ in any of the language. This is a symptom explainer. The symptom explainer videos for the parents, symptom checkers and triage tools, AI alerts for vaccination schedules and missed doses. So patient request, AI scheduling, confirmation of the parent, whether they understood the appointment and the medications that can be done with this. Automated appointment scheduling, smart billing, claims processing, those who are doing insurance practices, this is going to be a very important thing. Inventory management, no last minute crisis. Patient of MI has come, but you don't have a tenecteplase in your hospital. It can predict usage trends like medicines, vaccines, and provides alert for restocking, lowering wastage. Efficiently unified data entry and productive suggestions are possible if you give the data in a proper way. And at the same time, automated data extraction from farms, minimal manual input, whatever the things are required, and there are fewer errors. Patient education, it is a very good tool. Just put the situation in ChatGPT or Perplexity, you will get a good answer for the things. And it will ask you whether you want pictures, whether you want videos, whether you want charts or not. There is something called as a clinical decision support system in patient care. How it helps? Early disease detection. It is a predictive analysis of EHR to identify at-risk children for timely interventions and improving outcomes. Suppose some child is asthmatic, the air quality is very bad, and the patient's PEFR is around 70%. It can give an alert to the parents that the child is likely to develop a episode of acute exacerbation of COPD. CDS suggests diagnosis, investigations, and treatment based on patient data, latest research, and local guidelines. Rare diseases are very well diagnosed with the help of Perplexity. You can do AI-powered triage and virtual assistants. Virtual health assistant answers routine queries and guides families for minor illnesses, saving your time for complex cases. And you can develop personalized treatment plans. For example, a person of type 1 diabetic, you can do a very much personalized plan depending upon whether he's studying or playing a football match. And most important is AI uses genetic, behavioral, and environmental data to recommend individual management strategies. So we are very close to personalized and precise medications. What can be the second part? Real-time transcription or digital scribes. These are called as ambient AI listeners and documents. Patient visit, your time is there. Evaluation of report and documentation, I will show you. AI summarizes lengthy or complex reports, helping you quickly understand and act in an essential finding. Imaging and diagnostic aids, there are lot of AI aids called as the AI doc or IQ. They scan lab results or X-ray, they catch subtle findings, enhance speed and accuracy. For pediatricians, automated growth and vaccination trackings, It tracks vaccination, schedules and growth parameters for the automated alerts for timely vacations. In the interventions, suppose if somebody is going to US for studies, depending upon the Indian vaccination chart, it will tell that in the US setting, in this particular state, this person needs a meningococcal. So EHR can be integrated. It scans signs, EHRs, flag data inconsistencies, and highlights urgent findings for the review. So with this, we talked about office work and communication. So I just tried this. I wrote a letter to one person who had called me for a conference with only these prompts. And there was one eye emergency, which one eye doctor has sorted out. So just put these two things in my chat GPT and see the wonderful way in which the letter comes. It whatever the things are there which are to feed, it is in the forward, but it tells you everything that whatever that here I met my mentor. So this is a very good time saver. You can prepare excellent letters with this. This is a short letter which encourages a junior in your community so that he can work much better. Very simple, 3 paragraph, what you have done and what you wish. So this is the way in which you can improve your communication in your day-to-day life, writing to your patients, writing reference. Now I have got a complex lab report. This is a 48-year female with a BMI of 28, 4-year diabetic hypertension, fasting glucose 67, postprandial 278, with a creat of this much, eGFR 75. So all asked the GPT that you analyze the report, explain about hypoglycemia. Are SGLT2 inhibitors is a drug of choice? So the patient, it analyzed the patient's report, it did all the work, whether it is high or low, how much is the reduction in the kidney function, and it gave me an indication that ChatGPT can be done with. Now this is a practical example. This is my patient. I have logged the name. This is my patient's analyzed prescription for drug interaction. You just pick up this image and put it into either Perplexity or ChatGPT. It gives a quick analysis summary. So what it is telling me, there are duplicate beta blockers, there are the polypharmacy, that means in diabetes there is heightened risk of hypoglycemia. There are multiple agents with CNS depressants. There is a steroid and diabetes interaction, steroid and NSAID interaction. There is a very high risk of developing serotonin syndrome, a deadly condition, and electrolyte imbalance. So it is an eye opener for us when we write a prescription. Take a picture of that, keep it on our desktop, and put it to the any of your tool of choice. It will come. It will give a proper summary table also that these are the drug combinations and these are the major interaction checkers. So here it writes that your fludrocortisone, it worsens your glycemic control. And what you see in this corner, these are the references. They are not talking into air. A combination of nortriptyline and tramadol, that in ultraset, can definitely increase the serotonin syndrome risk. Now I got a very odd type of CT scan of abdomen. You can make out there are multiple calcium deposits, the bone density is not very good, and there are another hollows here. So whether it is automated analysis of a lab report or growth chart, whether it is a flagging of abnormal vitals for digital monitoring, or whether it is a complicated case analysis, I put this image and there was a summary report. It tells that it is a bilateral medullary nephrocalcinosis with small cortical renal cyst and mild fatty liver infiltration. And it tells me also management also. And if you see the last thing, if you provide me clinical details and laboratory results, I can help you the tailor-made management recommendations for. So it is definitely going to reduce our time for managing complex patients. Is it possible for you to even imagine that can you suspect diabetes from chest X-ray or pulmonary function test from facial analysis or moments of LNSI? These are the references which tell you that how the mediastinal fat indicates onset of diabetes 10 years later. In chest X-ray, if we get a nodule in the chest, it is a big problem. But with the help of AI, with 98% accuracy, it will tell you whether it is benign or malignant. Fundoscopy is an integral part of our day-to-day life. You can diagnose around 385 diseases with the help of fundoscopy, which has been aided with the help of AI. A digital AI ECG, it can diagnose lot many systemic diseases like peripartum cardiomyopathy or even hyperthyroidism. This can pick up the age and sex, even anemia, filling pressure, or congestive cardiac failure. These are all the references from the respected journals. Even I are not put on lot many newer ones, but peripartum cardiomyopathy was one which so struck us, and we could diagnose and pick up certain cases. So we talk for AI for documentation, like voice to text consultation notes, AI generated prescriptions, which summarizes for the patient and education. But beautiful education leaflets also are possible with the help of that. You can do a follow-up care, automated follow-up reminders, chronic or at-risk care, telehealth integration for remote consultation. Now let us come with a part which we want to do, but we are unable to do. So how you do use the tools in research and publications. Literature search and review automation. They scan global database for the latest research, summarizes trends and gaps relevant to a rural and practical pediatrics. The example is illicit. We will just see how it works. Research data generation. It can study the designs or analyze community health records to identify research opportunities for regional issues. You must remember the work done by Dr. Himatra Bavaskar about scorpion sting and the latest issues of hair loss. Data analysis and visualization can be done. Statistical tools powered with AI perform complex analysis and create publication-ready charts tables from your data. You don't need to pay anything. Your Excel is sufficient to do this. Manuscript writing assistance. There are drafts, policies, and translate research manuscripts and abstract analyzers, which improve your chances of acceptance. And reference management. It automates citation and bibliography tasks, ensures compliance with the journal, whatever the things are there. So these are the 5 major points which will help you. So just to give a snapshot of the generative AI tools, for research paper writing, you have so many steps, like structure creation. You take size space, elicit or cite, SCIT. What it will help you? Automated outlining, template matching, and content generation. Very effective content generation, which you can personalize later. Here you can polish it with ChatGPT and Perplexity. Then once your contents are generated, go for the drafting assistance. There is a paraphrasing, generate citations, reference integrations. These are the things. Billboard, Grammarly is there with everywhere, consensus and size. So we are done your referencing and everything. Then you need figures and tables. So if you need figures and tables, there is a visual data representation, a tool called as a Tableau. And AI generation of tables and contents and integration of description. Again, it is possible with ChatGPT and Perplexity. The last 2 tables which I showed about drug interaction, they were not created by me. It was a Perplexity job. So please take a snapshot of this. Size space, illicit, Grammarly, Quillbolt, Tableau, consensus, and cite. It is a sort of a ChatGPT for the research. Perplexity, you can download this Brook, Notebook LLM. Gamma is a wonderful software for creating presentation, and the Copilot, which is there in our system of computers, also helps you quite a lot. You can talk to Cloud and it will give answers and very positive outputs of your problems. So this is a generative AI prism, whether it is iterative, it is innovative, whether it is communicative, either it is experimental or exponential. You just increase the view of this and you will find literally dozens of same work doing AI tools. Now, if you want to have your journey of AI solutions, don't miss, don't miss to add Mid Journey, Gemini, Grammarly, and Perplexity to your the dashboard of your. For CME and learning, personalized learning feeds based on the patient cases, case simulation, and pediatric emergency drills. These are all possible with the help of different kind of simulators, and even you can use something like a quiz program called as a Kahoot. In Kahoot, you give 5 different options, and then you can live see how many people are doing it correct or how many people are going wrong. A simple and basic research tool, illicit. You have to better to take a paid version. These are the different features, testimonials, pricing. You put one subject and you will get the top 4 or 8 references on the same subject. When you want to go for a community outreach, social media post generation for health awareness, or which are tailor-made for your area, language, and socio-economic status, please try to use Gamma AI, and or other app is called as a Canva, or even your regular Chat GPT also nowadays gives very good editable slides, which you have to try. You can try from all the 3 sources. So friends, our AI tools are going to enhance family time, reducing burnout. You are reducing clerical work by 50 to 60%, enable more quality family time, less overload, shrinking paperwork, automatic repetitive task results in a more predictable hours and less after hours clinic work. It improves our work-life balance. With reduced manual documentation and administration, you regain personal and family time, and it combats stress and your work. At a glance, definitely there is a green picture. This approach lets you to focus more on clinical care and research. It decreases stressful work. I request you to start with a very few easy to use AI application like Perplexity, ChatGPT. AI-driven EHRs or documentation aid. First, take it on your mobile or first take it on desktop. Try to learn the nitty-gritties and try to use on both the platforms. So this is the implementation of roadmap. Identify your needs, what you want. Create templates of 10 types of communications which you are going to do. Then choose the tools, train your staff, learn from your staff, and monitor outcomes. So there are steps everywhere, but this step is a modern step which can climb with the help of a button. So we have to really be on an innovative side. All people always think about privacy and ethics, data protection, patient consent, secure systems. Most important is the cost benefit chart. Without AI, you are wasting a lot of time. With AI, you are gaining almost 10 to 12 hours a week. There are certain potential pitfalls, over reliance on AI, technology literacy, internet issues. Many people ask me that, are you going to make some idiot doctors who are enabled with AI? But it is not so. It is human intelligence always is better than any artificial input what he gets. You have to know the integration tip. Use the mobile first tool, start small and scale up absolutely gradually. Now the biggest question asked is from where to learn? Who is going to teach us? So there is nothing teaching. You have to learn days. We go to Google and ask, I want to learn artificial intelligence in medicine. You will get all these types of ghastly pictures, which are confusing to you. This was my article 3 years back editorial, and the recent editorial also has come in August 2025, where we discussed digital technology in medicine from calculators to ChatGPT. There is one book. It is a monograph of digital technology in clinical practice with my colleague, Dr. Sagar Sinha, who is a emergency medicine head in MGM Kamote. And there is one very good book by my friend Amit Kumar Dey and Bharat Sabu. It is available online. And don't forget this journal. This is called as the New England Journal of the New England Journal of Medicine, AI. It is a dialogue on medical artificial intelligence. It is the Journal of Future Medicine. There are top other sources to learn. These are the different kind of journals. There are more than 50 of its kind, but I picked only 10. Nature Machine Intelligence, Lancet Digital Health area, which has got impact factor. This is the transactions of medical imaging. There is a Journal of Artificial Intelligence in Medicine. There is a Journal of Medical Artificial Intelligence. There is a Journal of Medicine and Artificial Intelligence. In International Journal of AI in Medicine and Healthcare, and NHM AI is expected to receive first impact factor in 2026, but I think it will go on the top of it. Ask your librarian to get these sources. There are many pharmaceuticals who help you to get these journals. In India, the problem is there is very low intensity of research. So this index called as H index, a metric that measures countries' scientific productivity and impact they produce. India ranks 19 globally as compared to 413. We have significant amount of data, but the utility has been low. So friends, the onus is on us using clinicians, institutions, and policymakers. There is a very odd concept called as a medical literature doubling time. 1950, it was 50 years. In 1980, it became 7 years. 2010, it becomes 3.5 years. By 2020, it was 73 days. And 2025, it is few hours. You know, imagine the way in which the medical literature is doubling. If you want to be a real systematic learner, please scan this QR code. We have already done, we have done one batch. Our second batch is going on. And you can scan this QR code to register for our next batch, which is a certificate course on artificial intelligence in medicine. Something similar in US will cost you around 6 to 7 lakhs. But this is a very good way because we are all monitoring and creating the data for Indian doctors. This is our Doctors AI group. You can join us on LinkedIn and get educated practically every day. 30 to 40 practical posts which we get on this. And this is our Doctors AI group. It's a WhatsApp group where you will get much more and more better information. So we do conduct 3 activities. One is called as a medical AI web hour. This is one is going on right now. Then we have got AI update hour, third Thursday of every month. It is the second Thursday of every month, 9 p.m. And we have got journal club, mainly for the students, the practicing doctors who want to know and explore more in the field of AI. We have one lot of podcasts on the YouTube channel. You can listen to them by your convenience. So what we do in this course, we give foundation knowledge, basic of AI machine learning, data science principles, relevant AI algorithm, and we give examples of how they are used in clinical practice. Definitely, friends, it is that AI that will definitely help you to see what you have been missing. And we are ready for the evolution of healthcare. I think IAP Palghar and IAP Raigad has understood the need and arranged for this presentation. So be part of us. Doctors AI, it is an artificial intelligence for doctors, community of the doctors, by the doctors and for the doctors. And this is our next unusual activity. It is a second summit in November 2025. We can get all the details from me and you please join our Indian College of Artificial Intelligence. We have got around 3,500 people on the community side and 300 members here. We have very good chance of getting research projects, research proposals, research funding and fellowships once the college goes in a full blow. So this is our 15th to 16th November. This snapshot will help you to know much more about a AI in medicine event, which is one of the most sorted out. And just to summarize, the AI enhanced pediatrician before AI was doing more paperwork, less patient family time, just high stress, After MI, he will be having more patient interaction, smart practice, reduced stress, and more free and family time. The last question is asked everywhere. Is AI going to replace doctors? No, it is going to give back them their time. It is whether it is a companion or competitor, whether a friend or foe. Will it undermine personal connections or will it push aside, replace a physician? The strong answer is AI will never replace clinician. There are many reasons for that. That is a topic for another webinar itself. So friends, I thank you all for your patience and request you to be optimistic, informed, empowered, futuristic, Atal and determined to build a bridge of knowledge, AI and clinical medicine. It will make a sea change in your life. I cannot forget the sanskar and the things which have been imbibed on me with my Mirrors Medical College background. And my teachers, Dr. Lele, Dr. Soltu, Dr. J.S. Kulkarni, and my always supportive for my family who has been, I'm really indebted to all of them for bringing me to this stage. Thank you very much for your patience.
Thank you so much, sir, for a very elaborative and very lucid presentation. I know that everybody is very curious and I am ready with my questions, but I will just take few questions from the chat box first. So Dr. Pallavi Madam has asked a very interesting question that in the gone years, there was a concept of family physician who have a personal touch to his treatment. Will AI take it away totally?
So, definitely not. Can you put the question in the chat box for more clarity?
Yeah, it is there, sir, in chat box.
It will be better you put the questions in chat box. Because can you please repeat it?
So in the or in the gone years, there is a concept of family physician who gave a personalized touch to his treatment. Will AI take it away totally?
No, it will not. It will not take out because still the concept of family physician, even though it is reducing a person who because you cannot take away the touch, you cannot touch away the empathy, you cannot take away the personal connections with the patient, the family interrelations. Because in our Indian healthcare system is totally different than the European or US healthcare system. And in that, it will help you, it will aid you, it will assist you, but it will not take out the concept. It will not.
Great. So I had a personal experience in my routine OPD practice recently. So there was a huge OPD rash and an 11-month-old constipated child, and she was asking advice about diet. So, giving a diet advice in a very busy OPD is a very difficult task. So I just done an experiment and just typed on ChatGPT, what is the high fiber diet schedule for an 11-old Marathi background child in a Marathi. So give it in a Marathi language. So it gave a very beautiful diet chart, which was beyond my imagination. So even I haven't thought of that kind of diet chart in my imagination. So how I should, as a doctor, I should confirm that it is, I can forward that material to my patient. So how much accurate it is? That is my question, sir, because many people are using it. Even there are sometimes in some there was an incident study that a child who was having recurrent hematuria, the patient came prepared with so many questions from ChatGPT. So how to handle such kind of scenarios? It is a two-way sword. It is from our side and from a patient side also.
Here is the point of prompt generation. So you have to ask a very, very clear cut crafted question. If you go haywire, then you will not get a proper. So, for example, your patient who is 11 months old and who wants a diet advice from you, you put the question in such a way that a very simple answer comes initially, and then if you have got any problem, then you can highlight that. If you want, if you have got time, because it is almost 1 hour, can I demonstrate you certain things?
Yes, sir. Please go ahead.
Oh.
With permission of Yashri, madam.
That
Yeah, we are happy to learn from you, sir.
yeah. I'll just show. I'm just taking. Just give me a minute. I will close my PPT here, and I will open Perplexity. The same question I'm going to ask to ChatGPT, and same question I'm going to ask Perplexity also. Give me a minute.
Meanwhile, I request all participants to ask the questions, because it's a very rare opportunity to get a direct answer.
Can you see my Perplexity screen?
Yes,
Can you see my?
yes,
So these
yes.
are my activity.
Yeah.
I wanted to analyze drug interactions. So what I am doing, you can see the clip here.
Yes.
So I am attaching a file. I am going to local file. I am going to go to my desktop, and in desktop, I got a folder. Now please forget the name of the patient. I open the prescription. Now you can see the prescription is moving around.
Yeah.
Yes. Now I click this button. It is reading one attachment, and it is showing me all types of drug interactions.
So beautiful.
You can see drug interaction between N-acetylcysteine and taurine, rosuvastatin, glimepiride, metformin, lack of. So it uses a general principle also. And if you have got some question, you can just click on it and it will give you. Now, I just stop this and I add something. Give me a list of medical colleges in Maharashtra. With cutoff points. And location. Just click on it. It is coming everything. And there is a reference from where it has been taken. All India rank and everything is there, because it is analyzing so many different kind of sources. Okay, and there are ways in which you can make a PPT. So can you suggest me some subject of
Sir, show us the diet in 11 months old child for
diet
constipation.
Diet in
11 months old child for
11
constipation.
months old
Vegetarian
child
diet.
with constipation. You can always compare also. So these are the references it has checked. It is giving, and now suppose if you want share, or you can copy this, and what I'm doing is I'm going back to our slides and posting it into the that I can share it with Vikas or anybody of you, and this can be either shared, exported, it can be rewritten. You can tell that this is, please rewrite. You have to be very polite. You cannot be rude. Please rewrite in context of Maharashtrian food. Styles and contents. You can say that you are not comfortable with the contents which you are giving. So jawar and bajra, everything is, it has. So what I do is I just copy it. I'm stop sharing. Then I paste it here. It is there for everybody else. Okay. So you have got all the questions. You can see it. It is almost 2078 articles which has come, which has analyzed, and it is given in the. There are some more message. Dr. Viren has asked, can we defend this reference in medical legal cases? No. Because whatever you are using, whichever tool you are using, it is the responsibility of the doctor who is using it. The point has been made very clear that you cannot be medical is not for medical legal use. That it is ultimately your conscious which is going to take. Now I give a very something one more simple example which we can which is our necessary for all of us. How to monitor home BP with pictures. So it is giving you all the details. Position yourself with hand, place the arm correctly. Related now, if you now what is telling, I can share videos, links demonstrating these steps visually. Let me know. So that I'm just writing, kindly share video links. The same thing you can do for nebulization, the same thing which you can do for injection practices. This is actually a OSC guide. This different British Heart Foundation. If you want to know which BP apparatus you should take, you should see whether it is a BHF confirmed, because the model which has been confirmed by British Heart Foundation is the rugged model. It is up to all of us to find out what exactly we want. You can run this video on your TV screen, which is there in the consulting room OPD. Patients are also very happy to know about it. And these are all very short videos. See the value, the educational value of this. It is a OSC guide. It is UKMLA guide. And it really tells you the exact position.
Hello, my name's Charlotte. I'm one of the doctors here today. Can I confirm your name and date of birth, please? Hi, my name's Grace Barrington. I was
You can download the things like
uncomfortable.
in
You can
whatever
stop at any time.
reference you want.
Okay.
See, it
Okay.
is an unlimited, the sea of information. I have to stop
Yep.
this now.
Uh,
Because it is
Now
still
place this on your arm.
running on the background.
yeah, Dr. Atta want to ask something?
You want to see a demonstration of gamma?
Hello, sir.
Gamma
Dr.
Yes.
Dr. Atta Bhatti want to ask something.
Yes. Thank you so much, Professor Kalkarni. It's excellent. It's very enlightening. I have two questions. When it comes to signals, there are also noises.
Yes.
So when the information comes a lot, our brain in prefrontal cortex to thalamus makes a lot of complex circuits to know what is relevant. That's my first concern regarding this emerging trend. So I have no doubt that this is the future complement to experts. But when it comes to growing people in the field, there comes a problem. You see a lot of scholarly people not knowing exactly what they are talking about. Because majority of brain learning is based on reinforcement by different senses. So that's the two things I would like you to comment on.
I will answer to your question. See, there is always noise in any information or any data. That's why we call it as a clear data or a segregated data or a crystallized data. And there is a situation called as an AI hallucination. My request to all of you is never believe on AI in a complete way. You have to always confirm with it. Even in the references which they give, sometimes the references are juggled up. One reference number to other one, and other second reference is for the other subject. And Dr. Bhatti, you are absolutely right in when it comes for the signals which have been picked up by the brain, and when you are using your fine tuning. It is a very developing science. It is not a full-blown science as it is, but it has got a huge potential. You can recall. Suppose if you are doing a test called as either like ENG, electronystagmography, and matching it with EEG or matching it with your ECG in a patient who is complaining of syncope, that he is getting syncope and he has got vertigo, he has got labyrinthine things also. These three parameters to correlate and to compare is humanly impossible. Here, your AI will come, it will help you. And I accept the concept of noise and the impurities in the data, which needs to be found. It is a very, very fast developing and very, new science in which there are lot many things are to be done. And for all my friends who are in India who are working in small place, I'm sure it is going to help them a lot in relieving their work. And I will be very happy. First of all, I appreciate your presence. And next time onwards, you can share your ideas and your experiments also. That will be it. Thank you.
Thank you.
So because it is now 20 to 47, almost
Yeah,
90 minutes.
90 minutes. So last question, sir. There is one more question. How to make PPT? It gives only 10 slides in a free version.
Last.
How to make a PPT? It gives only 10 slides in free version. Dr. Tendulkar has asked this question.
No, because please tell it again.
How to make PPT? It gives only 10 slides in free version.
Okay. Yes, Shantanu has asked a very apt question. He is our friend from Sawantwadi, Dr. S. Tendulkar. a fitness freak, marathon runner, everything. So if you want more things, then you have to pay for that. There are certain other app applications in which you can prepare more. Even if you can get help from your simple PowerPoint, and with the help of your Google and ChatGPT, it will give good slides. But the problem with slides which are made with Gamma, the figures are unrealistic. You can make out that the slides are made with Gamma. So my best suggestion for you is to prepare a script of one A4 size paper, then put it to ChatGPT or Perplexity, and then get the layout and the link, and then add your own pictures according to your choice. Some amount of labor is appreciated rather than taking all the ready-made things. Ready-made things have got some problems. It is that one size doesn't fit all.
So what I take from all this is that I can, as a pediatrician, we face a lot of issue regarding the children with the behavioral issues, or those who are suffering from autism and all that, because diagnosis itself takes a lot of time, long queues, there's a struggle for the therapies. We have a privilege to work in the metro cities, but I really sometimes I wonder how the pediatricians from the interior parts of the country, they struggle so much to get a specialist. But now the AI module like Canvas DX can help us to actually diagnose these children in a slightly better way. And we can definitely, like for example, having the patient information, getting the videos of the child from your mobile, and the assessment of a pediatrician or a developmental pediatrician can definitely increase the speed of diagnosis and getting the right children in the right line. Because sometimes a child who doesn't require a behavioral therapy, he's taking a behavioral therapy, who doesn't require a speech therapy, taking speech therapy, it happens just because of the dearth of scarcity of the clinicians. So here the AI can help. Now I request, before we conclude, I request Jayashree Madam to give her wisdom and share her takeaway from this whole presentation.
I'm so happy, and it's a wonderful to see many bright minds gathered here to understand the future of AI. And I admire most about our expert speaker, Dr. S.V. Kulkarni, that he never loses what is truly matters for the patients, and also embracing the transformative power of AI to make us smarter, faster, and more intelligent to understand the patient and its care. Thank you so much. I am so happy to learn from you, and we still want to learn many things from you. Thank you from Palghar Academy of Pediatrics. Thank you, sir.
Thank you so much, madam. I request if Abbas Patankar is listening, he can, because he's a very keen observer, he can share his wisdom. Dr. Abbas Patankar sir, are you there? Okay. Dr.
Your audio is very low.
Hello, sir.
Your audio is very low.
Hello, sir.
Yes,
Hello,
please repeat.
Yeah. If Abbas Patankar is listening to me, he can just.
I think he is not there, so we can wind up the session.
Yeah. So I request Jayashree Madam to give a vote of thanks.
On behalf of IAP Raigad and IAP Palghar, for all the audiences who are still here, and for the innovative learning curiosity which we all have, I thank Dr. S.V. Kulkarni for his insights on artificial intelligence, and we will definitely learn a lot, and we'll still want to learn more from you, sir. Thank you so much for sparing time. Thank you, Dr. S.V. Kulkarni.
Thanks for the opportunity and discussion.
Thank you, sir.
Bye.